Hello everyone, this is Dr. TSR, Dr. Tejaswini SR. Today I am here to discuss with you regarding how to evaluate a secondary amenorrhea. So secondary amenorrhea means the lady has menstruated at once. So now she is coming with secondary amenorrhea. That means now she is not menstruating. Okay, so that maybe the duration may be 6 months or 3 months in case of regular cycle, 6 months in case of irregular cycle. So when she comes with secondary amenorrhea, the most common physiological cause for secondary amenorrhea is pregnancy, right? So first thing which we should do is UPT. Confirm it is negative. When the UPT is negative, the second thing which we should assess is the hormonal profile, that is prolactin and TSH. So when the prolactin is normal, if TSH is normal, then you proceed with progesterone challenge test. Usually in OP basis, what we also do again is this ultrasound abdomen and pelvis will confirm whether there is any PCOS. Like that we will also check. So basically prolactin, TSH, UPT negative, give progesterone challenge test. What you will give progesterone challenge test? You will give medroxyprogesterone acetate 10 mg for 5 days. After that you will wait for another more 5 to 7 days. If she bleeds, that means it is positive. Positive withdrawal means already her uterus is primed with estrogen. So you are giving progesterone. That means after ovulation only they will get progesterone. Here there is no ovulation. So the cause is anovulation, PCOS. Post progesterone challenge test, if there is bleed, that is anovulation, PCOS. But if there is no bleed, give estrogen also. That is in the follicular phase we have estrogen. So give both estrogen and progesterone. If she bleeds, after estrogen and progesterone, if she bleeds, that means estrogen is not there. So estrogen component adding, there is a bleed. There is bleed. So that means the problem lies in the central nervous system. Whereas if there is no bleed, even after you giving estrogen, you giving progesterone, there is no bleed means there is local uterine cause. So what may be the most common cause? That is Asherman syndrome. There may be adhesions. So there is no bleed. Okay, so rule out the uterine anomaly. If there is bleed, that means the problem lies in the central nervous system. So check for FSH and LH. If FSH and LH is low to normal, so that means FSH is coming, FSH is less, then you do the imaging study. If the FSH is high, FSH is high means the problem lies within the ovary. Ovary is not producing the estrogen. So that means it can be a cause of Turner syndrome, or Turner syndrome usually comes with primary amenorrhea. Mainly we will be thinking about premature ovarian failure, or she's going for menopausal state, ovarian failure. If FSH and LH is low to normal, that means pituitary is not functioning well. Then you do CT scan of pituitary. You have to rule out any problem. Pituitary disease is there. Most commonly secondary amenorrhea pituitary disease. What you will think of? You will think of Sheehan syndrome, right? That is postpartum pituitary necrosis. So you check for any pituitary disease is there or not. If there is no disease, CT pituitary is normal, then the problem lies within the hypothalamus. Now hypothalamus is not producing GnRH, so now that's why the pituitary is not functioning. That's why FSH and LH is not coming. If FSH and LH is high, I already told it is an ovarian failure. This is in brief about secondary amenorrhea. Thank you so much.